So how do we start deciding when we might lift containment measures? There are four key things that we look at. Firstly, you want to see a dramatic decline in the number of deaths and the number of cases of the disease. Second, you want to make sure that you have really widespread testing capacity and that you have good tests that work well and that you can get results back really quickly. The third thing you want is you want to make sure that your healthcare systems are not overburdened, they're not overstretched, and that they're ready to deal with potentially new cases. And this starts to get interesting when you think about a potential second wave of the new coronavirus hitting later this year, perhaps, which is when the flu season starts to peak too. So we'll be keeping an eye on that. The fourth thing that you think about and that you're looking at closely when you consider peeling back containment measures is the ability to do something called contact tracing. Contact tracing is real getting dirty, boots on the ground kind of work that I used to do, which is where you're following up with each and every person who you know is infected and where you're saying to them, when did you first become exposed? When did you have symptoms? And you're using that information to figure out when that person was infectious. And then you want to know from them everywhere they went and everyone they spoke to during that contagious period. And by doing that, contact tracing hopefully helps you get ahead of the virus, find people who may have been exposed and not known it, and ideally isolate, quarantine them, or treat them if you have a treatment, which we don't yet for this new coronavirus. So those are the four key things you're thinking about. In terms of looking forward, you want to lift containment measures gradually, methodically, and guided by science. So again, like I said, you're thinking globally, but you're acting locally. And you're making sure that the decisions about lifting measures and trying to go back to some kind of normality are the right timing for your communities, because you want to guard against those future outbreaks and you do not want to endanger lives by rushing forward. Now, I mentioned treatments, and we don't have proven treatments yet, but we do have clinical trials of drugs such as remdesivir, which was initially a failed Ebola treatment, which is now showing some promising signs in patients with COVID-19. It's really early to say that that works definitively because it's still in clinical trials. So it's being given to some patients, mostly with severe COVID-19, and day by day, we're learning new information about when it might work and who it might help most. The vaccine field is absolutely startling at the moment because we're seeing unprecedented speed in vaccine development. So I can tell you that as of now, there are more than 100 vaccines being developed around the world for the new coronavirus. A couple that I'll focus on in this brief update are the ones that seem the furthest ahead in terms of their testing. And I have to just preface all of this by just letting you know that a typical timeline for vaccine development is more than a decade, 10 to 15 years we're talking about, and tens of millions of dollars. It's really expensive work. You have a lot of failures often in vaccine work because you go through these different phases. Sometimes, even when something's really promising, it gets to that final stage and it looks like it's great, it fails because it can't be scaled up and manufactured at large doses. So I just want to preface that so that you're aware of some of the challenges that we're up against. So I want to quickly end this lightning talk by talking about reinfection and immunity, because I'm getting so many questions about this and I've been reporting on this steadily. We've heard already that there are some reports from Japan, South Korea, other places, that people who've survived infection with COVID-19 a few weeks later, a few months later, have very, very low levels of protective antibodies against the virus. And so there is some concern that reinfection could happen. In fact, there have been some patients in South Korea where it looks like they've had COVID-19, had a positive test result, then had a negative one, been given the all clear, and then tested positive again. But I think a major caveat of that is that it may not be reinfection. It may be that that negative test in the middle of those two positive ones was a false negative. Or it could be that the virus is hiding out in the body and causing some kind of reactivation, but not reinfection. So we're still learning a lot about immunity. It's so early on, and we are dealing with a new virus here. The good news is is that even if it looks like antibodies to this hang around for not long, which is the case with the seasonal coronaviruses that cause the common cold, hence we get the cold every year, the good news might be that with vaccines, they do instigate a different kind of immune response that might be more robust than natural immunity. But also, maybe we end up in a situation where we have a successful vaccine that you have to get a booster shot to give you that long-term immunity. So really fascinating things happening in the world of immunology and vaccinology, really unprecedented speed. I would say I've never seen anything move so quickly in terms of vaccine science, just in the race against this virus. So as I end, I want to let you know some of the things that I'm reporting on and that I'll be talking on in the next weeks. I'm a correspondent for Wired, so I make weekly videos or a few videos a week. And some of the things that I'm really interested in are some of the biggest mistakes that might occur if we are rash and we hurry to reopen. I'm also looking at the future beyond this pandemic, because to be honest with you, for scientists and public health physicians like myself who study epidemics, we've known that something like this would happen. We know that events like this are actually predictable and imminent just because of the world that we live in, how connected we are and how interconnected we are with animals. So I'm really looking and tracking scientists who are on the front lines of public health, who are trying to save us, not just by responding to this pandemic, but thinking ahead to what might be next, and how could we as humans get ahead of the next pathogen so that we're not always trailing behind.